Getting a hair transplant is a daunting thing. You want to know that you can trust the clinic and the surgeon that you have elected, but that is the difficult thing that you have to do before you even get the procedure. How do you identify the right place for you, often based on the budget that you want to spend for this procedure? Whether you are looking in Istanbul, Bangkok, Mexico, New York City, Kansas City, Denver, you have to vet clinics for the exact same things. So let's get into that in this video. First, an introduction. My name is Adam Hurly. I'm a men's grooming journalist. I have been covering this industry for over a decade for titles like GQ, Men's Journal, Forbes Vetted. I have had a hair transplant. My partner has had a hair transplant. This is a video series documenting my friend's hair transplant. We went with him to Istanbul to follow the procedure. Now we're following his recovery and regrowth. And so I feel well equipped to answer this question. How do you choose the right clinic? But first, we should probably kick it over to our sponsor. They actually do help you choose the right clinic. If you are going to Istanbul or Germany, they can help you there, but they are not interfering with any of the information I'm going to give you in this video, I promise. So let's hear their spiel. This entire hair transplant series was made possible by the Hair Alliance. The Hair Alliance helps people like you get matched with the perfect hair transplant clinic based on any number of factors. Contact them with any questions or to get started at thehairalliance.com or use this QR code. Let's get into the questions that you probably have about this process. First thing I think you should ask the clinic that you are vetting is, who is going to be doing the procedure? You might be thinking that the doctor should be the one doing the procedure, but that's not the case. The technicians at the clinic are the ones often doing the labor of extracting and implanting those thousands of grafts. A doctor can't give you that dedicated attention if they have multiple patients in the clinic at any given time. If you do want the doctor to do the procedure, it's going to be a much more expensive procedure. That said, the doctor should be present for certain aspects of your day. And that is really another question you should be asking is, what is the doctor present for in addition to who is doing the procedure? In all the experiences that I've had and my partner had, the doctor was the one auditing the density of the hair, the amount of follicles that we were going to transfer. He was the one drawing the hairline on. He was supervising all of the procedures as they happened that day, just in case anyone needed him. I compare it a lot to going to the dentist. You often expect that the dentist is going to be the one cleaning your teeth and doing that, but no, the dental hygienist is often the one doing that. And they're dang good at it too, because they're doing it day in and day out. So just trust that the technicians who are doing this are probably really, really well equipped to be doing it. They do it day in, day out. But you should know what role the surgeon is going to play, and you should have some FaceTime with him or her at some point in the process. Their name is on the clinic for a reason, but they are often supervising. The next important thing to do is to see the results of that clinic. Not only to see before and after photos, but to use a critical eye when you're looking at them. It's so easy for places to have their before pictures be in low light, have a frown on the person's face, just sort of looking disheveled. And then the after photo is this beautiful, glammed up, well-lit vacation photo of the guy, and he's got his hairline and everything. No, you want to see a very side-by-side, similar looking, similar angles. You need to see the density and the change in that. But in doing that, you also need to compare that person against yourself. Try to find somebody whose images match your hair density, your hair type, your hairline. You can ask the clinic for these before and after photos if they have a patient whose case is very similar to yours. You really want to see the work and the things that they are the most proud of. The pictures on their site are going to be their best work. So if you don't like their best work, then I suggest you book someplace else. And again, just use a critical eye and make sure you are feeling like you are being told the truth with those photos. I do find it difficult to vet by reviews, especially because reviews can be hyperbolic. Someone who did have a really bad experience might be expressing that on the review, but sometimes that person might have gone in with the wrong expectations or maybe was a bad candidate in the first place. So sometimes I just like to read as many reviews as possible and then synthesize them and just ask myself, is this clinic taking in people who shouldn't be patients? Is this clinic making a lot of the same mistakes that are reflected in the reviews? Are the reviews showing their own before and after photos to justify being upset? And then on the other end, are the reviews that are really favorable showcasing their results? Or is this clinic just flooding the zone with favorable reviews reviews from people that they know in their personal life and didn't actually go there. So just try to look at who's really excited in that 5-star, I love this place kind of range, but look at how they're justifying it and use the same critical eye when you're looking at the people who give it a 1-star or a thumbs down. Let's talk about staying local or going abroad. Now, my audience tends to be largely Americans. You might be wondering, should I stay local or should I go to New York City or LA or Miami, one of those bigger US cities? Or should I go as far away as Istanbul or Bangkok or Mexico? The bigger you go, of course, the more options you have. But in those big US cities, for example, those banner cities, that's where you might get the more steep prices. Oftentimes, the people going to those clinics are just going for the doctor themselves. So he or her will be the one doing those procedures in their clinic. They might offer various types of cosmetic procedures in their clinic. And in that case, that brings the price way up to $20, $30, $40, even $50,000 or above. So I like to tell people, think of the market you're getting the procedure in. If you want a price in the $8,000 to $15,000 or $20,000 range in the US, you should be targeting those medium markets. That's your Minneapolis, your Denver, your Kansas City, maybe your Chicago even. This is for the average 2,500 to 3,000 graft range. Remember from the other videos in this series, we talked about the fact that the number of grafts often dictates the price of the procedure because it dictates the amount of time spent, the amount of care given. And as you go to those bigger cities, then you get the more elite surgeons who can justify charging the higher prices because their clients are more high profile, or they're the ones offering that more boutique experience. I compare it a lot to things like Botox or teeth whitening, all these vanity treatments. It's always way more expensive when the people you're competing for that seat, that time, are millionaires or sometimes billionaires. Let's use Istanbul as an example of a medical tourism destination where there's a high density of clinics, where there's a high density of surgeons, and where the industry, the infrastructure is really dedicated to this specific thing. You might hear the word hair mills often used typically by local surgeons or surgeons who aren't in these markets. And I like to remind people that if you are in a place like Istanbul where you have so many options and you have these beautiful clinics, prestigious places dedicated to it, yeah, you can feel a little bit like you're on this conveyor belt and this assembly line just going through one step of the process to the next, just changing hands. That's why it's going to cost you anywhere from $2,500 to $5,000 for the same procedure that would cost 10 times as much in New York City. And a lot of times those packages include hotels and meals and airport transfers and van transfers to the clinic, some aftercare attention. There's a lot included in that, and that's what makes these places really attractive. So please don't believe any fear mongering regarding hair mills or the fact that it's going to be impersonal for you to go to these places. It is on you to feel comfortable and to feel like the clinic that you're working with, even far afield, is giving you the attention you need, answering the questions that you have, even through language barriers. They even probably have someone who speaks your language who can be there on site if you need it. In my case, as a native English speaker, pretty much everyone at these clinics is speaking English as well. So it just becomes really, really silly for me when I hear doctors even in the United States saying, if you go far away, it's so dangerous, you don't know what's going to happen. Personally, as someone who is a hair transplant expert, as somebody who's had it and who feels like it's been a life-changing procedure for me, I just don't think I could justify $50,000 on a journalist's salary for a hair transplant. I would sooner put a down payment on a house or buy a car or invest that money. I don't think I would put it into a hair transplant. So I just think having these markets where it is so affordable, so easy, and you can pocket in some tourism on top of that. To that note, watch my video on what to do in Istanbul as a tourist before your hair transplant. Count me a fan of the medical tourism any day of the week. But again, it's on you to do your homework. So let's get into the other aspects of this process. The next thing you need to ask your clinic is what is included in that package. I already said a lot of these places far afield, they will include things like airport transfers, hotels, car transfers between the clinic and whatnot, sometimes meals. Typically, they won't include your flights. They might have booking agents who can do that if you don't want to. But you also want to know what's included at the clinic itself. Are you getting PRP as part of the procedure, where they inject your own plasma into your head? Are they going to do a laser treatment? Are they going to do some stem cell injections? Does the package include things like the blood work that they're going to do before the procedure, the type of anesthesia they're using? Does it include the follow-up care the next day, the first wash, the explanation of your routine the next month? These sorts of things might be really expensive if they're add-ons at a local clinic. So sometimes it can benefit you to just book part of a package deal, especially if you're going far away. But one thing to understand is that they are not going to know how many grafts they're moving around until they do some of those scans in the control session before your hair transplant. Typically, this will happen the day before the transplant. So they can only make an estimate, and when you actually get there, then they can give you the final count. You can talk about the technology. This can fluctuate the price a little bit, so it helps to ask what those various ranges of costs might look like before you arrive, just so you aren't shocked and you're prepared to go in and understand that you're not being upsold or you know exactly what you want. I explain more about that in some of our earlier videos, the day before the hair transplant as well as the day of the hair transplant. Now, to the tune of the number of grafts. Be extra wary if a clinic is telling you that you need a minimum number of grafts. There should be a baseline that they charge for their time and for you occupying that chair. However, there shouldn't be a minimum number of grafts. If you don't need 2,000 grafts moved, then sure, maybe the baseline is you have to pay for 2,000 grafts, but they should not be moving grafts unless you need them. Not to mention, maybe the supply area on the backs and the sides of your head can't supply the minimum number of grafts. So you should be extra cautious if they are saying you have to do this amount. If you are someone with extra curly hair, even coiled hair, black men, this is especially relevant for you. You need to make sure that you are seeing before and after photos of people who have your hair type, your hair pattern, or you need to make sure that this clinic is specialized and often treats patients of your profile. There is a different angle at which that hair goes into the head, and that's exactly what a hair transplant is predicated on. It's all about cutting and implanting a hair at the perfect angle so that it grows out naturally. And so you need to make sure that the place you are going to is well trained in really curly or coiled hair. So ask your clinic for those specific before and after photos. Ask them about the punch size of the tools that they're using because they are going to need to draw bigger channels in your head to accommodate for those curls. Otherwise, the cuts that they're making for straight hair like mine are not going to satisfy your thicker, coarser hairs. You risk a lot more transection, lower survival rates, more scarring. And if you especially know that you have a keloid or scarring risk, you need to bring that up. Make sure that they have the materials and the training and the results to prove that you are in good hands. I also like to encourage people to see a local dermatologist, somebody in your market who can often do a lot of the scans and assessments for you before you book anything. This person might give you a realistic expectation of how many grafts you can expect to move around, what to anticipate for the recovery and regrowth process. This is also a doctor that's so imperative to your entire hair regrowth and hair retention process. This is somebody you should have a relationship with well before you book a hair transplant because you should be figuring out how to do things like taking minoxidil or finasteride. The other thing I think you should vet for is whether the clinic is asking you questions about your current hair retention strategy. If they're just eager to have you book the same day and come in no matter what, that's a red flag for me. They should be aware of whether or not you've been taking things like minoxidil and finasteride, these medicines that can really help regrow, retain your hair. The hair that you are moving around from the backs and the sides of your head, sometimes from under your beard, that's never going to fall out once it's transplanted. It is not predisposed to falling, so no matter where it moves on your head, it's not going to fall. But the hair that's native to the top of your head, that can continue falling after a hair transplant. So you want to make sure the clinic isn't just there to make a buck, to get your business. They should be aware of your profile so that they're then educating you on, hey, maybe it's a little too early to consider a transplant. You also want to make sure they're educating you on the fact that, yeah, the hairs that are native up there aren't going to be forever. So you might have to get a second transplant much later if you aren't going to be taking minoxidil and finasteride after the fact. So just see what kind of education they're offering you. You can come to my videos for these things too. I'll help you out. But you can tell a lot by a clinic and their eagerness to make a buck or to actually look out for you by how willing they are to provide education and set expectations for the long term for you. If they're not asking you all these kinds of questions about you and your profile, about your hair density, about curl pattern, all these things, red flag, look somewhere else. book somewhere else. All right, guys, those are my best tips for vetting these clinics, making sure you land on someone that you trust, that's communicating back to you. Let me know if you have any other questions about the process. You can ask those in the comments below. We've got all these other videos in this series that probably answer a lot of those questions. You can also follow Matt through his process of the transplant and the regrowth, all in this playlist that we've got. Take care, and I'll see you in the next video. Again, if you are considering a hair transplant, please contact our partner in this series, the Hair Alliance, at thehairalliance.com or using this QR code.